If you've noticed a lump near the opening of your vagina, then you might have a Bartholin's cyst. They don't always need treatment, but it's always important to get any lumps checked by your doctor. In this brief video, we're going to cover what a Bartholin's cyst is and who they typically affect, symptoms, how it's diagnosed, and finally, treatment options. So Bartholin's cysts usually affect women aged between 20 and 50, but they can affect anyone with a vagina. A Bartholin's cyst happens when small glands in the vagina become blocked. However, it's often not known exactly why the glands become blocked. Now, if a Bartholin's cyst becomes infected, this can cause an abscess, and we'll discuss more about abscesses later on in this video. A Bartholin's abscess might be caused by infections including sexually transmitted infections or STIs such as gonorrhea or chlamydia, although this is not always the case. In terms of symptoms, the main symptom of a Bartholin's cyst is a soft lump on one side near the opening of your vagina. It can be small and painless and may not cause any symptoms. A Bartholin's cyst can range in size from the size of a pea to the size of a golf ball. Other symptoms can include discomfort or pain in the area surrounding your vagina or vulva when you walk, sit down, or have sex, or one side of your vaginal lips could look larger or swollen. Now, it is possible that the cyst can become infected, and if this happens, it might turn into an abscess, a more serious infection. Now, symptoms of an abscess can include smelly discharge from the abscess, feeling unwell or having a high temperature, or intense pain around the abscess. So let's now briefly discuss how a Bartholin's cyst is diagnosed. Well, sometimes it can be found during routine examinations like cervical screening or your smear test. You might also notice the lump by yourself when showering or wiping. Now, it is important to speak to your doctor if you have noticed a lump in or around your vagina. And it's especially important to see a doctor urgently if you notice that it gets bigger and more painful, typically within hours or days, there is pus in the lump, or if you feel unwell or have a high temperature, or the lump becomes tender, swollen, hot, and red. However, redness may be harder to see on black or brown skin. Now, this is because these could be signs of an infected Bartholin's cyst or an abscess, which I mentioned earlier. Now, when you go to see your doctor, they're going to look at the lump to check if it is a Bartholin's cyst. You should also let them know if you'd like someone else to be in the room with you, someone called a chaperone. This could be someone that you know, such as a family member or a friend. It could be a nurse, or it could be a trained member of staff. If the doctor is not sure what's causing the lump, they may refer you for further tests at the hospital. Finally, what is treatment for a Bartholin's cyst? Well, if you've been diagnosed with a Bartholin's cyst, it will often go away by itself without treatment, but there are things you can do to help relieve discomfort or pain. These include sitting in a bath with warm water a few times a day for 3 to 4 days, dipping a clean cloth or cotton wool in warm water and holding it gently on the cyst, and if you're able to, taking ibuprofen or paracetamol to help with the pain. Importantly, don't try to squeeze or drain the fluid from a Bartholin's cyst yourself, because this can just cause infection. Now, if a Bartholin's cyst bursts on its own, this is okay, and it should ease the pain. If this does happen, keep the area clean and dry to help stop infection. Finally, if you've got an infected Bartholin's cyst, you might be offered antibiotics, and if antibiotics don't work or the cyst keeps coming back, you may need a surgical procedure to drain it. Now, draining a Bartholin's cyst might be done under local anaesthetic, where you'll be awake during the procedure, or with general anaesthetic, where you'll be asleep. Now, this procedure involves making a cut in the cyst. The doctor might leave a small opening so that fluid can drain out by itself, or they might insert a small thin tube known as a catheter into the cyst. You'll usually have the catheter in for around 4 weeks before it is removed. Now, during the procedure, the doctor might also take some fluid from the lump to test for infection. For more information on Bartholin's cysts, please do check out the links in the description box of this video, and if you've got any questions or feedback, please leave it in the comments section as well. Until next time, thanks for watching and bye.